Good day. The topic that I choose for the project paper is the effect of mother's age and the parity on the need of episiotomy on vaginal delivery during the childbirth. Slide into the portal shortly. So, in this slide, we're going to discuss about the introduction for the project paper, the topic, and also the literature review and methodology. Under the introduction, we'll be discussing on objective of the studies, background studies, problem statement, and also research questions and significance of the studies. So what is episiotomy? Episiotomy is a minor surgery on a woman's perineum, the vagina, during the process of child delivery. So why they do it is because the wound, as the baby was delivering, there will be a cut. There will be some tearing happen. If it was done manually by the house surgeons, the wound will be healed faster. The risk of severe and multiple tear is reduced, and the sexual satisfaction post delivery is increased. It will be normal, and the complication of urinary incontinency will be reduced. So what is the risk of episiotomy is bleeding and also tearing into rectal tissues. Sometimes when the episiotomy is done, it will be affecting the rectal tissues and anal sphincter muscle, which control the passing of stool. It will cause swelling, infection, and collection of blood in the perineal tissues and pain during sex. The problem statement is the benefit of the selective administration of episiotomy not only reduce the maternal complication and also reduce the need of suture. So the Malaysian circular statement on episiotomy is it shouldn't be 30%, the rate of the episiotomy shouldn't be higher than the 30% of the delivery happening in a hospital. So this study is basically to investigate the rate of episiotomy in government hospital with specialist care and to study the risk factor contributing to the need of episiotomy, and also what are the factors that contribute to episiotomy. There are 3 research questions that we'll be discussing on this project. The first one is, does age group affect the decision made regarding the need of episiotomy? What is the relationship between parity of the mother, parity as in the number of children carried by the mother, and the need of the episiotomy? The average percentage of the episiotomy done in government hospital under 30%, which was stated in the Malaysian circular. The objective of this research paper is to identify the difference among the mean of age group and the need of episiotomy, to determine the relationship between the number of parity and the need of episiotomy, and the third one will be to identify the average percentage episiotomy takes place in government hospital. Significance of the study is no proper procedure or guideline was drawn to decide if the episiotomy is needed. So the research will give rough idea which in further investigation and also the further research can develop into proper SOP, which will be helping the newly appointed house office and also reduces the risk factor of episiotomy for the patients. By knowing the basic detail about the patient, it is easier for the medical officers to decide on the need of episiotomy or not. In this way, we can maintain the government fixed rate of episiotomy in a hospital. So now we are moving on with the literature review, and non-episiotomy protocol appears to be safe for mother and child and highlights the need of investigate whether there is in fact any indication for the procedure. This was stated by M. Morim M. in Rua Neuza Bome Rama in 2004. As a result of occurrence in episiotomy was of 16%. There was an association between primiparity, younger age, no previous vaginal birth, oxytocin, lower Apgar score in the first minute, and meconium. After logistic regression, the variable that remained associated were no previous vaginal birth, oxytocin, and lower Apgar score in the first minute. This was stated in 2014 by Rodati, Betancourt, and also their colleagues. Okay. Primiparity was associated with episiotomy. There is no association between fetal outcome and episiotomy. This was stated by a researcher in 2017. And also, according to Van Roon, Y, Melson, L, and Percival R, K, Pathak, S, Pradhan A, in 2017, variability in mediolateral episiotomy should be reduced by use of fixed angle scissors on true, validate health professional training program to improve visual accuracy. As per Kramna Petra and Krama Petra in 2016, women with second degree perineal tests lowest score value were found in the domain of arousal and orgasm, and this woman had a lower total FSFY score compared to those with first degree perineal tear and women who received an episiotomy. However, in primiparous women only, there was no difference between this group. And according to researchers from China in 2014, with regards to severe perineal laceration during vaginal delivery, there are multiple obstetric contributory factors dispute routine episiotomy among them. Nulliparity, longer labor duration, and greater newborn head circumference, and instrumental assisted vaginal delivery. The latter should only be performed after careful evaluation. In a nutshell, perineal pain was related to factors such as long perineal cut, slow wound recovery, prolonged active phase in the second stage of labor, neonatal overweight, and mother's prolonged sitting position. This was stated in 2015 by Aratmar, Mariam Hazari, Sadiq Sakari, and Mohammad Taqi. Most midwife reported this was according to Wu L.C., Malhotra R. Allen, J.C. Jr., Laidi, and Tan T.C. In 2013, most midwife reported reasons for episiotomy were not congruent with international practice guideline. Women without episiotomy have lesser tests than those with episiotomy. Practice protocol and educational programs are needed to change episiotomy practice. So for the research, the data was planned to collected in as a secondary data from patient database from hospital portal. The patient's private detail as per patient's medical condition and name, address was not revealed. Other than that, the data needed as in the patient's age, the parity will be collected from the hospital database. So the analysis of data that we're going to use for this, as per methodology, we're going to discuss about data collection and analysis of the data. So the data was planned to collect as a secondary data from a patient's database from hospital portal, and the patient private details as per the patient medical condition will not be revealed, and also only the needed data such as the age of the patient, the parity number of the patient will be taken, and also this will be done under proper supervision of hospital authority. As per for analysis of data, I was planned to use Microsoft Excel version 2010 and also SPSS and also SAS Studio Edition 9.4. So basically there's a five analysis method that we'll be using. First, demographic and personal characteristic of sample, frequency of epistemic conducted, and normality test, analysis of variance, ANOVA, and also Pearson correlation. So as for demographic and personal characteristic of sample, a graphical analysis method is used to analyze the sample which is related to the variable that being studied, such as age and parity. And graphical method will be used is pie chart and bar chart. The frequency of each category is clearly stated, and the percentage is will be calculated. And the frequency of epistemy conducted is the rate of epistemy conducted divided as per the age group and also the parity number, and the highest frequency of epistemy conducted in both category will be stated, and the result of the frequency percentage and cumulative frequency cumulative percentage will be provided to give a clear view for the satisfaction. Then the normality test, Shapiro-Wilk test. Normality test will be used to determine if the data set is well modeled by the normal distribution, and to compute how likely it is for the random variable underlying the data set to be normally distributed. So other than that, we'll be using ANOVA. ANOVA test is the way to find out the survey of experiment result are significant. In other words, they help you to help to figure out if we need to reject the null hypothesis or accept the alternative hypothesis. Basically, it will be testing the group to see if there's difference between them. So the one-way ANOVA is used to determine whether there is any statistical significant difference between the means and the 3 or more independent groups. So in this case, yeah, that's what it is. So we'll be also discussing about Pearson correlation. The correlation is used to test relationship between quantitative variables and categorical variables. In other words, it's a measure of how things are related. The study of how variables are correlated is called correlation analysis. The correlation coefficient is a way to put the value to a relationship. So in this case, we're gonna see if the age and also epistemy is correlated, or the parity and the epistemy is correlated. And thank you for your patience. That's the end of the slide, and thank you so much for listening to me, and hopefully you understand my presentation, and have a good day.